Hello and welcome to Easy Medics Daily. Today, we're talking about mastitis, a painful breast condition that often affects breastfeeding mothers, but can also occur in non-lactating women and even men. If it isn't recognized and treated early, mastitis can lead to serious issues, like a breast abscess. In this video, we'll explain what mastitis is, why it happens, its symptoms, treatment, and how you can prevent it. So, what exactly is mastitis? It's the inflammation of breast tissue. This is usually caused by milk stasis, which is when milk builds up, a bacterial infection, or a combination of both. It most commonly happens during lactation, especially in the first 6 weeks after giving birth, but it can pop up at any stage of breastfeeding. There are a couple of types of mastitis. The most common is lactational mastitis. This happens in breastfeeding women when milk isn't fully drained from the breast, leading to inflammation. Then there's non-lactational mastitis. This type is seen more in smokers, women with nipple piercings, patients with diabetes, and individuals with weakened immune systems. This kind can be recurrent and often needs a closer look from a doctor. Let's get into the causes and risk factors. The main culprits are milk stasis from incomplete breast emptying, blocked milk ducts, and cracked or sore nipples, which create an entry point for bacteria. The most common bacteria involved is Staphylococcus aureus, but streptococcal species can also be a cause. Things that increase your risk include poor breastfeeding technique, skipping feeds, wearing tight bras, weaning too suddenly, and even fatigue, stress, and dehydration. So how does mastitis actually develop? It starts when milk accumulates in the breast. This builds up pressure in the milk ducts, which triggers inflammation. If bacteria manage to get in through tiny cracks in the nipple, an infection can start. All of this leads to the classic symptoms of pain, redness, swelling, and fever. What signs and symptoms should you watch out for? Locally, in the breast, you might feel pain and tenderness. You could see redness, often in a wedge-shaped pattern, along with swelling and warmth. You might also notice a hard or firm area. Systemically, you might experience fever, chills, body aches, and fatigue. These symptoms usually only affect one breast at a time. Diagnosing mastitis is mainly based on these clinical signs. Further tests are usually only needed if symptoms don't improve after 48 hours of treatment, if an abscess is suspected, or if the infection keeps coming back. In those cases, an ultrasound might be used to check for an abscess. Now, for the important part, management and treatment. First and foremost, continue breastfeeding. Do not stop. Frequently emptying the breast actually helps you recover faster, and it's perfectly safe for your baby. Next is supportive care. Use warm compresses before feeding to help milk flow, and cold compresses after feeding to reduce swelling and pain. Make sure you're drinking plenty of fluids, getting enough rest, and you can take paracetamol or ibuprofen for pain relief. If a bacterial infection is suspected, your doctor will likely prescribe antibiotics like flucloxacillin or cephalexin. A typical course of treatment lasts about 10 to 14 days. If left untreated, mastitis can lead to complications. These include a breast abscess, which is a collection of pus, chronic mastitis, or causing someone to stop breastfeeding earlier than planned. In rare but serious cases, it can lead to sepsis. How can you prevent it? Ensure you're using a proper breastfeeding technique. Feed your baby frequently and try to alternate breasts. Avoid wearing tight-fitting breasts, treat any nipple cracks as soon as they appear, and maintain good hygiene. To wrap up, mastitis is a common and painful condition, but it is very treatable. Recognizing the signs early and getting the right management can prevent complications and help you continue your breastfeeding journey. Thanks for watching. Follow Easy Medics Daily for more simple and accurate medical education.